The one thing about an emergency room is a lot of families use it as primary care. I started to see things in the ER that didn't correlate with what I was taught in medical school. I'd see these kids who I was supposed to diagnose with an ear infection, and I did. I gave them amoxicillin, and they'd come back 2 weeks later, sick again. There was evidence that we may need to be a little more cautious. But still, in 2025, pediatricians are giving it like water.
Vaccines, when they are quote unquote tested for safety, they're tested against another vaccine or another aluminum containing injection.
That's not safety testing. Vaccination is an ideology. It's a cult. It's a religion. We're poisoning the brains of our children, and we're doing it knowingly. I started to learn chiropractic was based on the body has the innate capacity to heal. Then Chinese medicine, body has the innate capacity to heal. I was introduced to naturopathy. I was introduced to Ayurvedic medicine. Same. How in God's name does Western medicine hold the principle that the body has the innate capacity to heal?
All right, the legendary, I got to say this, the man, the myth, the legend, Dr. Lawrence Palevsky. I call you Dr. P. A lot of people call you Dr. P.
Dr. P, Dr. Larry. You know, usually if they say Dr. P, I ask if I need a cup.
Dr. P. Yeah, it depends on if there's a comma there.
Correct.
Right. I'd like to start this conversation by having you take us back to 1987 when you graduated from medical school. And let's start there with your journey.
All right, happy to. But I want to go back about 5 or 6 years before that, because I never wanted to be a doctor growing up as a kid. And I thought I would be a lawyer when I graduated high school. I was very much into theater. I was rocking it on the stage. And after first year of college, my theater teacher from high school, when I saw her after my freshman year of college, I said, Fran, I'm not going to go into theater. And she took her head and she went down like this and she said, what a shame. And it hit me, because I years later, obviously, I wonder, what could have been.
Right.
I certainly wouldn't fit into Hollywood or theater today had I done that. But so I never really wanted to be a doctor. And it sort of like magically came to me sophomore year of college. So this was about 1981, 82. I said, all right, major in biology. I'm good in science. I'm good with people. I'll go to medical school. And so began my medical career, which I never really, when I told my parents I'm going to go to medical school, they were like, what? Like, where are you coming from? They had no idea. So I went to medical school. I hated it. I just couldn't stand it.
What did you hate about it?
Well, personally, it was a tough time for me because I was starting to recognize some of the deep-seated anxieties and depression and traumas that preceded me in my childhood that I didn't know about. And it just something seemed off. And I went through it. I did it. I was really glad for the first time in my life I didn't have to get grades. I could just pass. And so it was such a relief to me that I didn't have to ace every test. I almost dropped out like 2 or 3 times in the first 2 years. And the last time was 5-6 months right before third year medical school. And my dean said, stick it out, get to clinicals and see how you are. And when I got to clinicals, I was in heaven. I just needed to be with people. And I did surgery, I did medicine, I did pediatrics, I did OBGYN, and then I did psychiatry. And it was very clear what was going to be pediatrics.
What made it clear?
It's interesting because I had been a camper, a counselor, a head counselor. I had done so much around kids. I loved kids. And it was so clear to me what I loved to learn about. And while I was in third year rotations, I was grabbing as much information as I could. I was listening to everything that I was taught. And I just enjoyed it. I thrived in it. And I loved the kids. Parents, everyone says, how could you go into pediatrics? It's the parents. And I said, yeah, but it's the kids, it's the kids. And I remember dabbling between medicine and pediatrics. And the thing that got me to do peds instead of internal medicine because the pressure to go at NYU School of Medicine was, you don't go to NYU School of Medicine and go into pediatrics. You go into medicine or you go into surgery. And I said, no. When I finally made the decision to go into pediatrics, the key point that I got to was, if I have a 55-year-old man who weighs 300 pounds, smokes 3 packs of cigarettes a day, and is on multiple medications, what can I do for that person? And this was 1985. I had no idea what holistic medicine was. I never even knew the word. And I just knew, I could make more of an impact with kids. And that sold the deal. And I went into pediatrics. And I did my residency in New York as well. And I loved it. I mean, I just took everything I could. I learned everything I possibly could. My father tragically passed away in the middle of my second year of residency, which, threw me for a loop. I was 27 and like, holy crap. But I learned medicine. And the beautiful thing about going to medical school from 1983 to 1987 and doing a residency from 1987 to 1990 is that all the mentors were pediatricians who had been practicing in New York since the 1940s. And so they knew before vaccines. They knew before antibiotics. They knew before CAT scans and MRIs. They knew to smell, taste, feel clinical medicine. Here we are in 2025, and we don't even see much clinical medicine anymore, right? So I got such an amazing education, and I loved it. And I remember third year of residency, I looked at one of the pediatricians who I respected, and I said, I can't go out and become a pediatrician. I don't know anything. He said, how long do you think you're going to practice? I said, I don't know, 30 years? He said, how many years have you trained? I said, 3. He said, therefore you have 1/10 of the knowledge you're going to have. And I took it. I was like, great advice. Because, you want to feel like you have the confidence to go out and be a pediatrician, and all you did was a residency.
Right.
And I went out and I kept learning. And my first job after I finished my fellowship, so I did a fellowship in outpatient pediatrics at Bellevue. And my first job after that year was in a pediatric emergency room in the Bronx. And this was like inner city pediatrics. And I started to see things in the ER that didn't correlate with what I was taught in medical school.
Like what?
Or in residency. So I'd see these kids who I was supposed to diagnose with an ear infection. And I did. I gave them amoxicillin, goodbye. The one thing about an emergency room is a lot of families use it as primary care.
Yeah.
So I got to know a lot of families in the Bronx because I was there a lot. And they'd come back, 2 weeks later, sick again. What was I taught? The antibiotic that was given to them is now making them have a resistant bacterial infection, so they need another antibiotic. So I gave them another antibiotic, and then they'd come back again 2 weeks later, still sick. And I stepped back. Now, this was on my own. And I just stepped back and I said, they don't look sick. I mean, they're, fussy symptoms, but they don't look like they have an infection. So I started to wonder, what's going on? That's what I was taught. Antibiotic, oh, sick again, antibiotic, oh, sick again, antibiotic, no. And around the time in the early 90s, I found these pediatric ENTs, ear, nose, and throat doctors, who were holding conferences about other ways to treat ear infections. Because probably about 80% of antibiotics in pediatrics goes to kids with ear infection. And I started to learn the literature that was coming out of Europe from 1990 onward that said most ear infections in children are not infections. And so fast forward into the 90s, into the 2000s, 2010s, 2020s, no matter how many bulletins the American Academy of Pediatrics put out, the American Academy of Family Practice put out about being more cautious before treating with antibiotics, because studies were showing, there were these big studies, one in 1997 and one in, I think, 2003, where they gave a group of kids prescriptions for the diagnosis of an ear infection. and told the parents, don't fill it for 24 hours. And in both studies, 2/3 of the kids never got antibiotics and they resolved. So there was evidence, even in American literature, that we may need to be a little more cautious. But still in 2025, pediatricians are giving it like water.
Yeah.
Yeah, it's bubblegum. Here, just take it. And the fact of the matter is, I started to question, well, if these aren't ear infections, what are they? And then I would start to see kids who were getting sick repeatedly, even if they weren't on antibiotics. Every so often they'd have more asthma. Every so often they'd have more seizures. Every so often they'd have more fevers. They were having sore throats all the time. And I'd say, why do these kids keep getting sick? And that was a question that in 8 years of medical school and training was never addressed, because the medical system is truly the Hegelian dialect. Problem arises, react to it, and here's the solution. Get rid of it. Suppress it. And here I was, almost 10 years after starting medical school. Wait a second, what's contributing to these illnesses?
Yeah.
And modern medicine gave me nothing. And I had nowhere to turn. So there was a nurse who was working in the emergency room in the hospital who was studying acupuncture. And I started asking her questions like, what's Chinese medicine? What do you do? Give me the she was teaching me all these philosophies. I'd never heard of any of the ideas. And she said, Larry, I have an acupuncture friend that you might like. She's already out of school. Why don't you go to her? So I went to her and I started experiencing it. This is 1993, 94. So I'd started in the ER in 91. And so I picked her brain. Like, what does that mean? What does that mean? What does that mean? I was always a curious kid. If you said to me something, I'd ask 10 questions. And then she said to me, I have a colleague who's a chiropractor. I want you to go see her. So about 1994, I go to see this chiropractor. And then I hear this concept. The body has the innate capacity to heal. WTF. I'm a medical doctor trained at NYU School of Medicine, Mount Sinai residency, right. Fellowship in NYU Bellevue.
First time hearing this.
The body has the innate capacity to heal, like WTF. But again, I was curious, teach me, what does that mean? So during those years in the 90s, I started to learn chiropractic was based on the body has the innate capacity to heal. And then Chinese medicine, body has the innate capacity to heal. And then I was introduced to naturopathy. Same. I was introduced to homeopathy. Same. I was introduced to Ayurvedic medicine. Same. I was introduced to herbology. Same. Tibetan medicine. Same. Japanese medicine. Same. Native medicine. Same. Western medicine. Huh? What's missing here? How are we not addressing this? So I had realized that asking the question, why these kids keep getting sick and what really were these illnesses? Why were kids constantly getting asthma? Why were kids constantly getting fevers? Why were they constantly having febrile seizures? And so I started learning Chinese medicine, the concepts, homeopathy, chiropractic, and I started experiencing them all. And I just kept learning more. And then by 95, all of a sudden nutrition came into me. And I moved out of the emergency room. I'm now running a pediatric ICU, not a major ICU, but a step down ICU. Nonetheless, kids were sick. And I was covering a neonatal ICU. And I was working in the ER. And I was working on the inpatient pediatric ward. And I'm learning nutrition. And I'm learning about hydrogenated oils. What the hell is that? Omega-3 oils, omega-6 oils. Well, I didn't get this in medical school. Why are they so important? And then I'm experimenting. So I'm taking hydrogenated oils out of my diet. Because when I used to do rounds in the wards with the medical students and residents, I'd be eating the Ritz crackers. And I love those Ritz crackers.
I did too.
And I'd be popping them.
Yeah.
And then, partially hydrogenated oils. Really? What is that? And so I did an experiment. I took the hydrogenated oils out of my diet and I added tons of olive oil. I just kept dousing everything with olive oil. Nothing else changed. I lost 5 pounds.
Wow.
I'm like, okay, what is this? And then I really got into Chinese medicine. I started shadowing a friend of mine who was an acupuncturist. And I was learning the energy of the body, the digestive fire of the body, the digestive energy, how children's digestive systems are different. And I started learning all these things, body, mind, and spirit, that from all of these fields that contributed to the status, the health, the state of health of children at any given time. And then I remember learning that in Chinese medicine, a child could be eating something and the intestinal system may not get bothered, but all of a sudden the kid could cough. Or the child would breathe in some noxious gases and the skin is all of a sudden showing rashes. So I'm like, wait a second. You mean to tell me that things can go in one way, but come out another way? So these were not things that modern medicine had taught me. And so I started to realize that, waste can go out the digestive system, but not come in from the digestive system. They could come in through the nervous system, or they can come in through injection, or they can come in through breathing. And so I was just fascinated, but still curious. How in God's name does Western medicine hold the principle that the body has the innate capacity to heal? And I couldn't find it. So I'm working with kids with asthma in the ICU or in the ward. And now I'm sitting with the parents and I'm teaching them about hydrogenated oils. I'm teaching them about sugar. I'm teaching them about omega-3 and omega-6 fatty acids. And of course, the word is getting out in the hospital that I'm doing this, right? And then I'm going to the deliveries of very, very sick newborns, or obstetricians almost destroying babies as they're being born. And I had learned Reiki. And so here I was, 1997, 98, and I'm doing Reiki in the delivery room. So the obstetrician pulls out a dead baby, pretty much flat, no tone, no cry, no color, just no movement. And my job is ABC, airway, breathing, circulation. So I decided I was going to make sure the airway was clear. I was going to make sure the kid was breathing. And I was going to make sure the heart rate was above 80, which is what ABC is for newborns. And I would turn the light off on the warmer. I would put the oxygen mask on their chest to blow into their face, assuming they were breathing. I'd put one hand under the head and I'd put one hand behind their heart and I'd stand there and do Reiki. Here's a baby not moving, but breathing and has a heart rate. And all of a sudden, I'd watch these babies get born. Their color would come back. They'd start squinting their eyes, blinking, opening their eyes. They'd start smacking their lips. And then the legs would come up, which is a great sign. And the arms would start to move and they'd start to wiggle. And the eyes would open. And I'd lean down and say, "Happy birthday, welcome." And I'd very gently get them ready, hand them to the mother and say, "Congratulations." And, when there's a high risk delivery and a baby comes out and the baby's not breathing, the world goes crazy in the delivery room. You have people running in, they're smacking the baby, they're punching the baby, they're shaking the baby, the lights are on, the mask is in the face, they're rubbing the baby. And I thought, how asinine. Why would you shock this baby? All you need is airway, breathing, circulation. And it was sort of my first foray into, wow, like miracle medicine. I was doing nutrition, I was learning about Chinese medicine, I was learning about homeopathy, This was wow.
Yeah.
And I was like, wow. And I would prevent kids from going to the neonatal ICU because they wouldn't have been the grunting, acidotic stress babies, because I allowed them to work out their circulation with oxygen, with patience, with time, with no stress, and just holding the space.
And trusting the body.
Correct. Because that's what I was taught. Airway, breathing, circulation. Make sure they're breathing. Make sure their airway's open. Make sure their heart rate's moving. And I would watch their respiratory rates slow down. I would watch their heart rates come down. I would watch their chests relax. I would watch their color come up. And that was my job. And I remember as an ER doc, as running the ICU, don't just stand there, do something. And here was a situation, don't just do something, stand there. But I was still doing something. Mm-hmm. And to me, that was one of the first big aha.
Well, probably because you're seeing the contrast in that space.
Yeah. I mean, this isn't anything in any of the medical textbooks.
Right.
You can find it in all other spiritual practices, right? And I had never seen miracles like that in medicine. I mean, I had babies that were really, really tiny, 500 grams, that I'd intubate, that I'd put IVs in, that I'd, save. But this to me was a miracle. Like, wow. Like, this is like, I don't know what's going on here, which is fun. It's sort of the unknown. You can now learn.
Dwelling in the mystery.
Right. And that's not something that I knew about in medicine, that there was a mystery.
Yeah.
I mean, I'd known there was a science, but I didn't know about the art, and I didn't know about the mysticism.
Yeah.
And this was fascinating. Word got out that I was doing this in the delivery room, because nurses would come in, nurse practitioners would come in. They'd see me there with one hand under the head and one hand under the back of the heart, with the lights off and the oxygen mask on the chest. And I'm looking down at the baby, watching the baby the whole time. And I'd turn my head to the side because I'd see somebody come running into the delivery room, and I'd look at them and they'd see my eye. They'd turn around and leave, because they knew that I wasn't going to let them touch that baby, because all they wanted to do was beat the kid, get them crying. No, you don't need to get them crying. You need to get them breathing. And they were breathing. And then you let the acidosis, you let the shock of the delivery stop, and you let the oxygen permeate, and you let them work it out. And I prevented babies from going to the neonatal ICU. And that was a problem, because it's all about numbers, right? And the department chair, I even did it for his nephew. And he called me in, he said, Laddie, because he was Italian. He said, what are you doing? And I said, I started to explain. He said, I don't want to know. He said, stop doing it, please. I said, but I saved your nephew. No. That's okay. And this was 1998. It was the same year that a mother came up to me and said, Dr. Larry, did you know that there's mercury in vaccines? What? Like, what? This is 15 years after starting medical school. And so here I am from 91 to 98, questioning, why are kids getting sick? Recognizing nutrition, recognizing the body has the innate capacity to heal, understanding all these other medical fields, but not really knowing where that rung out, where that was found in Western medicine. And now there's mercury in vaccines. And so I don't know what happened, but something very, very striking happened to me in that time. And I invoked the precautionary principle. And I looked at the nurse in the clinic, and I said to myself internally, I can't vaccinate these kids until I know what the hell's going on.
Wow. You didn't experience any of the cognitive dissonance, or you hear a lot of stories from mothers who, when they try to bring this up to a pediatrician, they're immediately dismissed. Do you feel like because you were already beginning to question so much of allopathic medicine? And
I don't know. I mean, it's 27 years ago. All I can tell you is that something struck me that said, I can't keep doing this. Uh-huh. I can't put mercury in the kids. And then I said, what the hell else is in these shots? And so kids would come into my clinic affiliated with the hospital where I was working. And I would say, he's got a sniffle. Let's not do it today. Or let's only do one. And then somewhere around that time, I had a toddler who got his boosters. And very soon after, within 24 to 48 hours, had massive fever and swollen lymph nodes in the neck, under the arms, in the groin. And I said, what the hell is this? And so word got out in New York City that there was this doctor affiliated with a hospital who has a clinic once a week, who's willing to see patients for a delayed schedule or maybe no schedule at all. And all of a sudden, these people who would never have come to a hospital outpatient clinic were seeking out general pediatric care from me. Like, what? I didn't know what I was stepping into. And so here we have, nutrition. I was starting to learn about essential oils. I was starting to learn about herbs. I was starting to learn about all these, homeopathy, naturopathy, Chinese medicine, Ayurveda. And so in the hospital, in the inpatient, I was helping parents shift the way their kids' health could become by doing these things, by adding these nutrients. And there was one time where I was covering the neonatal ICU, and this mother had the 32-week twins. And for everyone listening, 40 weeks is supposed to be full term.
Supposed to be.
Right. That's why I use the word. Right. And so she had a boy and a girl. Now, they were Caucasian, white, and there's a well-known tale in neonatal medicine that white boys are the weakest of all babies.
That's pretty well established.
Yeah. Like you have a black girl, the expression is you can't kill them. Because if they're born premature, they are the strongest. They thrive faster, they move quicker, they get better so fast. Whereas all the way on the other side of the spectrum is the white male. Weak, doesn't do well. That's the generalization.
Yeah.
There are going to be parents who are listening to this saying, that's not true. My white boy did fine. He did fine. That's not what I'm saying.
Yeah,
what I'm saying is there's just a general understanding that when the neonatal ICU gets a call from the delivery room, hey, we have a 29-week mom who's in labor. It's a boy. She's white. Ugh. Because we know that they tend to have more complications.
Interesting.
So this mother had a boy and a girl, 32 weeks, and the girl died soon after. And the boy was on what's called CPAP, oxygen, 41%, and lingering, just not moving. Every day, 41%, 41%, 41%. We couldn't get his lungs to mature, and we couldn't get him to come down on the oxygen requirement. And the mother was pumping breast milk, and the kid was being fed with a tube through his mouth into his stomach. And I pulled the mother aside, and I said, I'm really sorry about your daughter. I said, I want to help you save your son. I said, if you're open to it, I'd like you to take 2 to 4 grams of DHA, fish oil, per day. And I want you to have in your diet the following foods. And she was a little hesitant. And I said, listen, I'll explain to you what omega-3 fats do, just so you know, the fats that he's getting in the in his IV are all omega-6. And these are pro-inflammatory fats. And no matter how much I've gone to my colleagues in the neonatal department and said, do you guys see what you're doing? You're giving these kids with bronchopulmonary dysplasia, with necrotizing enteritis, enterocolitis. You're doing all these kids who are premature, who have major amounts of inflammation, and you're giving them pro-inflammatory fats. I'd show them literature, and they walked away. So I said, screw it. I mean, my job is to save the kid. So I went to the mother. I mean, I'm 36, 37 years old here. And I said to the mother, I'd like to help you. Would you be willing to change your diet, eat this, take 2 to 4 grams of DHA per day? She said, yes. Within a couple of days of this kid getting the breast milk, his oxygen went from 41 to 29%. And then right down to room air, and he's thrived. And I just said, okay, there's something here, right? One of the things that is a feature of my personality is I'm very curious. And the scientific method says, observe a finding, ask a question. What was the finding I observed? Omega-6 fats are inflammatory. This kid's inflamed. He's 32 weeks. He's premature. He's white. He's got lung disease, airway disease. He's needing oxygen. He's not moving. What's my question? Is there anything I can do to help him? What's my experiment? Go into the literature and see what I can do. What does the literature say? DHA, omega-3s can help. So I just said to the mom, are you willing to try it? She said, yes. Experiment done. That doesn't mean it's going to work for everybody. But what it means is I did a scientific project based on literature that supported what I was doing. He did well. And what's remarkable to me is that no neonatal ICU really does omega-3 fats for these premature, highly inflamed, sick kids.
Till this day.
Till this day.
That's crazy. That's crazy.
So nutrition is not a field of medicine. In 1983, when I started medical school, the first day, the dean comes in, introduces himself to the class of 87. And within the first 2 minutes, and I don't know why I remember this, but in the first 2 minutes, he says, I want you to know that nutrition is not a field of medicine. It's like, what? Why?
Was it like super off the wall too, like out of nowhere?
But what's even more off the wall is that I remembered it.
Yeah, right.
Like it just hit me.
Yeah.
So there were obviously parts of me that were working.
Yeah.
That I had no idea were working.
You're like, what? This doesn't make sense.
Why would you say that? So yeah. And then by the year 2000, I was out of the hospital and I was in private practice and I've never gone back to the hospital since.
You know what stands out to me about what you said regarding Ayurveda, traditional Chinese medicine, homeopathy, et cetera, chiropractic. If you look up the Wikipedia pages for any of those, every single one of them says based in pseudoscience or something to the effect of based in pseudoscience, which is just so hilarious.
Right.
And then I have a question related to the vaccine things. I'd like to discuss that just a little bit. You're probably tired of it at this point because you've been doing it for so long. But when you started to question vaccines and their ingredients, did you bring any of this up to your colleagues, the glaring issues you were finding? And if you did, how did they respond?
Yes. So in 1998, when it came up and I was still on staff at the hospital, I was finding all of this information about the ingredients in the shots. And I was delving. I mean, I went into the library. Like if I had no patient care to do, even sometimes if I had notes to write in the chart, I was in the library and I was just combing through article after article, trying to find safety studies and trying to find information about the vaccine ingredients. And as anyone who's not under a rock knows, there are no safety studies, right? And then there are no studies about individual ingredients either.
Right.
Which boggles my mind. Like, how in God's name are we not asking the question, Senator, are you aware that there's this ingredient in shots? No, I was not. Do you know what this ingredient does when it's injected into the body? No, I don't. Senator, did you know that this ingredient while it's injected in these shots multiple times to kids, has never been tested for injection into kids to see what it does once it's injected. Which always boggles me. They talk about vaccines, but nobody just gets down to the nitty-gritty and says, what's the safety profile of these ingredients? Let's just take one ingredient. And nobody does it. So in 1998, when I was showing the literature to my colleagues, they just shake their head and walk away. Shake their head and walk away. And so by the time I was in private practice in 2000, my practice was based on the families that I had accumulated since 1998 in the clinic. Plus, the word had gotten out into New York that there was this pediatrician who was willing to either allow the kids to go on a delayed schedule or to not get them at all. And the thing is that I didn't give them. That was done by the nurse. This was the first time being a doctor where my position as a doctor really changed. I mean, yeah, the nutrition stuff, the just teaching about other aspects of medicine.
That didn't interfere necessarily with your training. It was an additional, you could say.
Right. But this was a real paradigm shift because prior to about, the late 90s, early 2000s, I was the doctor. I told you what to do. I was the doctor. I told you what not to do. And all of a sudden I started to see my role differently. And I don't know where I got it. It just sort of arose out of my own process. And all of a sudden, I'm looking at parents and saying, okay, I'm going to educate you. I'm going to empower you. I'm going to offer you information. And I'm going to give you enough of guidance where you get to come to the logical conclusion that's most optimal for you and your family. And I didn't know what I was doing. And then I realized years later, here we are 25 years later, what I was doing, which was informed consent. And I was actually changing the dynamic of the relationship between patient and physician. And I was becoming more of a teacher. Even though I was still very strong in my clinical opinions, I was all of a sudden developing these ways of guiding rather than condescending, browbeating, coercing. And it's been years, over the years, I've learned how to coerce less and be powerful over less and less persuasive and more in relationship, right? And that's been an amazing achievement just in the relationship of being somebody's physician and being a teacher.
You're great at teaching. I really have appreciated knowing you, knowing the man that you are and the teacher that you are over the last 5 years and really beyond that, because I was watching a lot of your material from 2016 through 2020 before we met. Most of you are already aware that our everyday devices are taking a real toll on human biology. Talking about our laptops, our tablets, our phones. Each one of these is hitting you with non-native EMFs, artificial light, excessive blue light, and constant screen flicker. And most of us are feeling the harmful effects whether we realize it or not. But there is a better option. Daylight Computer is actually solving all these problems at the root. And I had an awesome conversation with Tristan Scott from Daylight on episode 202, breaking all this down. Here's a brief clip from the episode.
We have a reflective display technology similar to a Kindle, which was really the inspiration behind the product overall. It's really intended to be a magic piece of paper. And the reflective technology works just like everything else in nature.
What are some differences between this and a Kindle?
Kindle was the inspiration, but it was limited. It's great for reading, for turn paging, but if you try and do anything else, it's too slow. We wanted to bring a display technology that feels like digital paper, but can do more. It can do email. It can go on the internet. It can go on social media. We created a Kindle on steroids, which now means it's a healthier iPad.
All right, so if you'd like to check out Daylight for yourself, just head to daylightcomputer.com or just head to the show notes and enter code TWF50 at checkout for $50 off your order. And if you're a member of the wayforward.com, just head to the member marketplace and you'll find an even greater member exclusive discount waiting for you there. I want to visit some of the lack of evidence for vaccines a little bit more specifically, if we could, for those who may be hearing this for the first time, because there's still people that are just coming across this information, which is wild to me, but there are. And then I would like to get into some of the anecdotal, and air quotes, experiences you've had for those kids who have been in your pediatric practice as well. One of the things that stands out to me, getting down to the nitty gritty, that I've come to learn over the last year and a half, really, with respect to aluminum. So I had previously been saying, and this is still correct, that the World Health Organization and other health agencies refer to studies in which aluminum is ingested in order to make the claim that aluminum is safe when injected. But it's even worse than I had imagined upon further research. So from my current understanding, there are two primary studies that these health agencies cite in order to make the claim that aluminum is safe when injected into the amounts that kids are receiving these days, and the amount that infants are receiving these days. And those studies are Mitkis from 2011. When I say Mitkis, that is the primary author of the paper. So Mitkis et al. From 2011, and then Flarand et al. From 1997. And so Flarand, in that paper, they looked at aluminum hydroxide and aluminum phosphate when injected into 4 adult rabbits. And they weren't even attempting to determine health implications of injected aluminum. They were only looking at biodistribution. So they were seeing how much was excreted after a certain period of time. Then fast forward to 2011, Mitkis, they, in that study, took the data that they received from the Flarand study, and then also took data on ingested aluminum in adult males and adult human males, and then extrapolated using some sort of modeling process what might be happening in children who receive injected aluminum. And those are the foundational studies that they use in order to make the claim that aluminum is safe when injected in the amounts that children receive today. And you might know that it's worse than that. It might be even worse than I've just said.
It is worse than that.
That's already horrible. So how could it possibly get worse?
First of all, there are 3 types of aluminum that you're talking about. There's aluminum that naturally occurs in nature. Then there's an aluminum adjuvant called a microparticle. And then there's an aluminum adjuvant called a nanoparticle. And so just to roll it back for a second, number one, they're not the same aluminums. Number 2, you can't compare them. If you're going to ingest aluminum, you have to inject aluminum. If you're going to ingest aluminum microparticle, you have to inject aluminum microparticle. And if you're going to ingest an aluminum nanoparticle, you have to inject an aluminum nanoparticle because they are different. The next point is that why is aluminum in the shots in the first place? And what people are not aware of is that when they did first experiments of taking microorganisms, again, whatever you want to call them, bacteria, viruses, pieces of what they considered bacteria and viruses, and they injected it directly into the body, there were little to no production of antibodies. And for people listening, the definition of an effective vaccine is a vaccine that produces antibodies, period.
A lot of presuppositions there too.
Right. But again, we can talk about, I'd love to talk to you about antibodies in a later part of this talk.
Okay.
Because our understanding of antibodies is so screwed but for the sake...
So screwed that it leads to something like this.
But for the sake of this part of the conversation, yes, injecting pieces of microorganisms into the body does not give what they desire as a large enough amount of antibody that they equate to immunity. Forget whether it's true or not. We're going on their model, right? So in order to have an effective vaccine, you have to find a way to catalyze the immune system's response to the injection of bacteria and viruses. And so they developed a microparticle, an aluminum microparticle. And if you look up aluminum microparticle as an adjuvant in vaccines, the literature says, at least the ones that I read, that it is a weak adjuvant, meaning it produces an antibody response, but not a high enough amount that they consider needed to make it an effective vaccine. Again, the tragedy is that we equate vaccination with immunity, and we equate the presence of an antibody with immunity, right? Which is so sad, Alec, because people walk around going, well, I'm vaccinated. So it doesn't mean anything. You don't know if you produce an antibody. You don't know if you produce the right kind of antibody. You don't know how long that antibody is going to last. And you don't even know if it's going to help you or hurt you. So, and you don't know what else the vaccine did when it was injected into your body. But you walk away going, well, I'm vaccinated. I must be safe. Oh, no, not even close. So they needed to develop an adjuvant that would spike up the antibody. And so they developed a nanoparticle. And so the aluminum adjuvants that are in vaccines today are nanoparticles and have been in the vaccines for a while. So, not too long ago, I was talking to a pediatrician who was challenging me on a medical exemption that I wrote for a child with neurodevelopmental delays who was supposed to get another aluminum adjuvant nanoparticle vaccine. And I told him my concerns about the further inflammation in his brain of a child who's already neuroinflamed with these developmental delays. And his answer to me was the pat answer. Well, there's such a small amount of aluminum in the vaccines compared to what children are exposed to in their lifetime. And I said, do you have a study to support that? Because, I've heard that statement thousands of times from general pediatricians, and they're talking out of their ass because there's nothing to back it up, that there's any truth to that statement or any scientific relevance. So what? It's such a small amount compared to what children are exposed to in their lifetimes. Tell me the difference between ingestion, inhalation, and injection. And then we can have this conversation. But until you show me those studies, you're talking out of your ass.
Answer, they do not exist.
Correct. Thank you.
Literally do not exist.
Thank you. No, they don't. So he was dumbfounded when I said this to him because I don't think anybody had ever challenged him on that statement. And I said, show me the study that substantiates what you're saying. Because in my view, you can't really compare ingestion and inhalation to injection. And the aluminum product you're talking about in ingestion and inhalation is different than the aluminum product you're injecting. Unless, of course, you're exposed to a lot of geoengineering, in which case you're probably ingesting and inhaling a lot of aluminum nanoparticle, in addition to who knows what other arsenic, barium.
Well, the last episode I did was on geoengineering, so that's interesting.
Yeah, and cesium and barium and arsenic and strontium. Yeah, okay. So he was dumbfounded. Oh, I have to look into that, he said. So what people are not aware is that the aluminum nanoparticle is a very strong immunogenic chemical. What that means is it catalyzes the immune system response very strongly. And the nanoparticle is a good binder to the bacterial particles, to the viral particles, and to whatever else is in the shot that we may or may not know about, like food proteins, like dust particles,
animal secretions,
foreign DNA, like other microorganisms, because vaccines are not sterilized. So the product is a crude, dirty product with many other pieces of contaminants. And nobody has ever checked to see whether those particles also bind tightly to the nanoparticles. So for people who are just learning about vaccines, you think that the vaccine nanoparticle is only presenting the bacteria and viruses to the immune system to invoke an adequate antibody response. You're missing a lot, because we also don't know what else is tightly bound to the nanoparticle, including the emulsifiers like polysorbate 80, right? So when I started reviewing these microparticle, nanoparticle, I came across the pharmaceutical literature on nanoparticles. And what I found was that the drug companies directly understand that when drugs are entered into the bloodstream, they can't get into the brain. They can't. And the reason they can't is because we are born with something called the blood-brain barrier. And the blood-brain barrier is an obstacle. And you'll find literature from 20 years ago, which say drug companies understand the problem that's presented with the blood-brain barrier in delivering drugs through the brain, into the brain. And so we've devised ways to get the drugs to go across the blood-brain barrier into the brain. And in those articles, they blatantly say, we use nanoparticles to attach to drugs, and we measure the drug content in the brain. And we find that when nanoparticles are bound tightly to drugs, they cross the blood-brain barrier and get into the brain. I'm reading this and I'm saying, holy shit. Because I already knew, Alec, that the vaccines contained aluminum nanoparticles. And I already knew that the aluminum nanoparticles were tightly bound to bacteria and viruses and cells and food proteins and contaminants. And I stepped back and I said, holy shit. They know that the vaccines that contain aluminum nanoparticles are entering the brain. And when you read the abstracts and the articles that the pharmaceutical industry puts out about the use of nanoparticles to attach to drugs, they actually say to target certain areas of the brain. And I'm like, holy crap. They are targeting certain areas of the brain with the drug bound to the nanoparticles. So one would conclude pretty easily that it's also targeting certain areas of the brain when the nanoparticle bound to viruses and bacteria and vaccine contaminants are also targeting certain areas of the brain. So I'm in the midst of all this literature, and then I find pharmaceutical industry is not happy just using nanoparticles attached to the drugs. Now they're using emulsifiers attached to the nanoparticle, attached to the drug. And they're finding in animal studies that with the emulsifier, there's much more entry of the drug into the brain than if it was just the nanoparticle attached to the drug. And I thought, wow, great. Guess what emulsifier they use? Polysorbate 80. And guess what emulsifier is in vaccines, especially the ones that contain aluminum nanoparticles as adjuvants. So I said, wow, the pharmaceutical industry is no different than the vaccine industry. And so they know that they are creating aluminum nanoparticle polysorbate 80 vaccine products that automatically enter the brain, regardless of whether it's intentional or not. And we can have a separate discussion about whether it's intentional. But then when you look, 1 in 6 children with neurodevelopmental disabilities. And when I first started doing this work, it was like 1 in 90 some odd kids with autism. And now it's 1 in 31. And then it was 1 in 11 kids with ADHD. Now it's 1 in about 9. And then you have 1 in 20 kids under the age of 5 with seizures. Then you have 1 in 5 kids with mental, emotional, psychological disorders. You step back and you say, what's happening to the brains of our children? And sometimes when it's right in front of you, you don't believe it. And when I share this information with families, I would say 99 out of 100 go. Because most of the time, if there's evil in the world, they tell you it. They put it right in front of you. And the question is, can you see it? Can you believe it? Can you absorb it? And can you get out of a fight or flight or freeze state and really do something about it? Right? And so my job is to just show it to the parents. Like, this is the literature. I didn't make this up. Don't you think that if they're using nanoparticles and they're using emulsifiers attached to drugs to get into the brain, to target certain areas of the brain?
Their quote.
Right. Don't you think that if they're using the same technology to vaccinate, that one would expect the same entry of material attached to the adjuvant into the brain? And so then the question becomes, do vaccine ingredients belong in the brain? No. Do they get into the brain? Yeah.
This is where Christopher Exley's work becomes really interesting as well.
Correct. Although when I first met him, it was difficult for him to understand that this was happening in vaccines.
Really?
Oh yeah. Initially, when I first met him.
Can you share a little bit? You're probably more well-versed to talk about Dr. Exley and his work.
Nah, I mean, the very first time I met him, he was showing that if you give Fiji water, I have no attachment to Fiji water. I don't make any money from them. And I'm not condoning that you go out and drink it. But he was showing that in an anecdotal study, he gave people in nursing homes Fiji water. And these people had Alzheimer's disease. And he identified that the active chemical, silicic acid, which is the active form of silica, was in the Fiji water. And anecdotally, he was showing that these people who were drinking the water had improved symptoms of dementia. And so he had already suspected the role that aluminum might be playing in dementia. And then, of course, everyone took off on that. And everyone took off on where the sources of aluminum are. But those who were careful in the medical community, in the naturopathic community, in the scientific community, would talk about all the places in which we were being exposed to aluminum. And they avoided talking about vaccines. And I was like, you can't. How can you do that? This is a direct 100% absorption of aluminum into the body. And then, Girardi in France came out with these studies showing that aluminum nanoparticle biopersists. In other words, it remains attached to tissues. And there's even some evidence in the literature that shows that you really don't need aluminum in subsequent vaccines because the aluminum that's in the prior ones that you're injected with will still catalyze immune system reaction.
Which implies it's still there.
Correct. Exactly. Right. And so Christopher Exley was showing that there's a way to start removing aluminum nanoparticles from the brain. It's a very, very, very difficult particle to remove because it doesn't just get into the brain. It gets into the cells of the body. And when I started reading about aluminum nanoparticles, I found two parts of the cell where they had identified the entry of aluminum nanoparticles. One was the mitochondria. And aluminum is a toxicant to the mitochondria. And so when you look at chronic illness in children and adults, what is one of the most underlying features that's recognized in chronic illness?
Mitochondrial dysfunction.
Right. And so, but everyone's looking around like this. What could it be? What could it be? Oh, so let's use CoQ10. Let's use methylene blue. Let's use hyperbaric oxygen. Let's stop poisoning the mitochondria, right? And so the other place is something called the lysosome. You know, for the cellular biology geeks, we have the nucleus, we have the Golgi apparatus, we have the endoplasmic reticulum, we have the lysosomes, we have the mitochondria. The lysosome is the garbage disposal of the cell. And the aluminum destroys the lysosomes. Well, what's the underlying feature of all chronic illness? Chronic inflammation. What's chronic inflammation mean? Chronic toxic wastes that build up in your body that can't get out. So essentially, these nanoparticles have destroyed the cell function. And we're looking around, why is this happening? Well, actually, Western society doesn't even ask why it's happening, which is so, like, talk about cognitive dissonance. You know, yeah, well, you know, you just have to live with autism. You just have to live with asthma. You just have to live with autoimmune disease. You just have to live with chronic inflammatory arthritis. You just have to live with inflammatory bowel disease. You just have to live with the tonsils the size of your, you know, of your fist. And the struggle I have as a pediatrician is trying to get people to realize that chronic inflammation is not a life sentence. It's not something you have to live with. You can actually try to identify the ways in which we electively put inflammation in our body on body, mind, and spirit levels.
Witnessed it with my wife. That's literally how I'm doing what I'm doing now in the world, is because my wife was under the care of conventional rheumatologists for nearly 10 years and was chronically ill with quote unquote lupus and rheumatoid arthritis. And then upon adopting what those experts would have referred to as pseudoscience and quackery, just adopting a very natural approach to health, eating clean, spending time in nature, really trying to connect with nature on all levels, mind, body, and spirit, what we're ingesting, what we're inhaling, et cetera, she drastically healed. Right. And one would call that the definition of the innate capacity to heal. Right. Well done. Right. I've heard you tell that story a number of times, and it's an important story to keep telling. And thousands and thousands of people have the same story, and they're just chalked up as anecdotes.
Many more than thousands, Alec.
Yeah. Oh yeah. Hundreds of thousands.
We're talking in the millions.
Right. Exactly.
And those who are dead can't talk about it.
Right.
But it affected them. So I want to go back to the aluminum and the sorbitol, because the story is much worse.
Yeah, you're going deep on this.
The story is much worse.
Yeah.
Right. And the reason the story is much worse is because the scientists who are doing studies on nanoparticles actually injected a series of nanoparticles into rats and then stained it to see where in the brain the nanoparticles were most likely to travel. And they found 3 areas of the brain where the nanoparticles were most likely to travel. 1, the ventral surface of the brain. I'll explain what that is in a second. 2, the dorsal surface of the cerebellum. And 3, the prefrontal cortex. What they were finding is that there was edema, which is swelling, and inflammation in those areas of the brain where the nanoparticle traveled once it was injected and went into the brain. The ventral surface of the brain is your medulla. It's your fight or flight response. It's your adrenaline. It's your subconscious brain. It's the brain that keeps your heart rate going, your respiratory rate going, your blood pressure going. It's your survival brain. It's your reptilian brain. So how many kids are hyperactive? How many kids are impulsive? How many kids are reactive, tantrums, unable to sit still? How many kids have outbursts? How many kids can't sit still? The ventral surface of the brain. The dorsal surface of the cerebellum. What's the purpose of the cerebellum? It's the first part of the brain in infants that establishes motor development. What is the number one problem in children, 1 in 6 children with neurodevelopmental disabilities? Hyperactivity, unable to sit still, and motor delays, all right? Now, what people don't understand is that the cerebellum is the most rapidly developing part of an infant brain. So it's most susceptible to toxicity. And when you poke holes in it, you don't get those holes back. When you inflame it, you don't get those inflammatory areas back. And brain development moves from the cerebellum forward. And if you create inflammation in the cerebellum, you have impaired brain development forward. And the third part is the prefrontal cortex. And what is most important about the prefrontal cortex? Speech. So now you're describing 1 in 6 children with neurodevelopmental disabilities. How many kids who do not get nanoparticle emulsifier containing vaccines have brainstem, cerebellum, and prefrontal cortex problems?
Very, very, very few, I'd imagine.
And then again, everybody's got their head. I don't know what's going on. Something's happening. I can't figure it out. So that's what's worse. And now I'll get even worse. So the MMR has been a hottest topic since 1998, when Andy Wakefield broke his study, which was never identified correctly.
Of course.
Right? So poor Andy, who is now being redeemed.
Very much so.
And Brian Deere, I don't know where he is in the world. So all Dr. Wakefield said was, these children with autism have increased inflammatory bowel disease. And, these parents said this inflammatory bowel disease came right after the MMR. And, the literature says that when children have live measles infections and live mumps infections in a period very close together, those children with natural measles and mumps infections close together in real life have increased incidence of inflammatory bowel disease. So why not give the measles and mumps vaccine separate? That's what he said. And somehow he became the foster child. Oh, the poster child, sorry. And the foster child. He became the poster child of vaccines cause autism. Even though he was right. So, being the curious guy that I am, for anybody who's still listening at this point, millions of parents report, my child was fine. My child was speaking. My child was looking at me. My child was playing. My child was engaged, related, connected. And then the child got the MMR and the kid disappeared. Stopped talking, stopped babbling, stopped eye contact, withdrew, got very sad, angry, running in circles, banging a head against the wall, flapping, spinning, rocking, grunting, aggressive. And as a physician, if I hear that multiple times, my question would be, what's in this shot? Is there something in this shot? Because, this story isn't random. It's not anecdotal anymore. Not when it's thousands and thousands and thousands. And so what you get is so much gaslighting and so much, ignoring of these parents who, saw it right in front of their eyes. And the doctor says, no, it had nothing to do with the vaccine. No, that's normal. And the parents are like, the fuck is wrong with you? No, it's not. I lost my kid. So when I started hearing these, I said what any scientist would say. If this is true, what's in this shot that would do this? The first ingredient in the MMR is sorbitol. The second ingredient is sodium phosphate. And the third ingredient is sucrose. After whatever they call measles, mumps, and rubella, right? Because anybody who's listening, who really is listening, you cannot, assuming viruses exist, you cannot inject a virus unless it's part of a cellular mechanism. So they're injecting measles virus, theoretically, with foreign cells, period. So there's automatically foreign cells, plus whatever aborted fetal cells on top of that. So how would you like to inject your daughter with aborted fetal cells that come from a line of male cells? You think it would change your daughter's hormones? How would you like to inject your son with aborted fetal cells that come from a female line? Do you think it would alter your boy's cell lines? Just saying. It's a question to ask. Although nowadays you're not allowed to ask a question, right? So, of course, my first question is, what the hell is sorbitol doing in there? Because sorbitol is a cousin of polysorbate. Now, again, I want the listeners to know, I'm not a toxicologist, but I can read. And I'm just telling you what I read. Now, if you don't believe me, go read it. So sorbitol is an emulsifier, but it's also a sugar. And sucrose is a sugar. And so I did a little dabbling. It's like, well, what are the properties of sorbitol? Sorbitol does not cross the blood-brain barrier, but sorbitol 6-phosphate does. So sorbitol plus sodium phosphate, does that give you sodium? Does that give you sorbitol 6-phosphate? Because if it does, it crosses the blood-brain barrier, much in the way that sorbitol, that polysorbate 80 does. But the other property of sorbitol is that it's an osmotic load, which means that if the sugar content of the blood is high enough, it can shrink the blood-brain barrier. And if you shrink the blood-brain barrier, anything that's in the blood can easily cross into the brain, which means that vaccine material and anything else in the blood can easily go into the brain. So what's the sugar concentration of sorbitol and sucrose? Anybody? Does it matter? Of course it matters. Because it can open up the blood-brain barrier. And here you have all these cells that are in the shot. So they're going to travel with it. So then I said, well, what else is sorbitol used for? And the interesting thing was that everything I found said sorbitol is not to be injected into the body. Sorbitol is not to be injected into that. I mean, I kept finding it over and over again. Sorbitol is not to be injected into the body. So what was that about? Vaccines are safe. So I then stumbled on something that just tipped it over. And that is that sorbitol is used with a carrier transport to bind to chemotherapy to enhance the delivery of chemotherapy drugs into the brain to treat brain cancer.
Wow.
Okay. So it's just like polysorbate 80. So now I understand a possible mechanism. Again, unless it's studied, I don't know. But now I understand a possible mechanism that could really destroy the brains of children who get the MMR. Because A, sorbitol is not to be injected into the body, but it is. B, it's never been tested for safety. C, we don't know the osmotic load with the sucrose. So we don't know if it's a high solute load that it shrinks the blood-brain barrier. And D, what's attached to it? And does that go into the brain? And so one has to ask these questions because these kids were normal before they got the MMR, or at least seemingly more normal than they were afterwards. And, the idiots will say, well, correlation doesn't mean causation. It's like, okay, come on over here and take an MMR.
But then that raises the additional issue that, going back to what you said earlier, there are no safety studies. People be like, what do you mean there's no safety studies? And one piece is that vaccines, when they are tested, quote unquote, tested for safety, they're tested against another vaccine or another aluminum containing injection or another injection that contains some vaccine ingredients.
That's not safety testing.
That's my point.
That is not safety.
Because it's presupposing that those, that
don't even give it those words.
It's not.
Because it's just a show.
It's a show.
It's a circus.
It's a circus. It's totally a circus because it presupposes that those substances have already been deemed safe or proven safe when injected. Most healthcare today operates on an outdated mechanistic model, treating the body like a battlefield rather than a self-healing system. You wait months for an appointment only to receive a rush diagnosis that labels you rather than truly understanding your unique health. Even in holistic health, many practitioners rely on endless lab tests and supplement protocols, addressing symptoms instead of the root cause. And the result? Another prescription or supplement regimen that merely suppresses or masks symptoms rather than facilitating true healing, whether the imbalance was physical, emotional, energetic, or a mix of all three. And that's why Dr. Tom Cowan co-founded the New Biology Clinic, to offer something radically different. As one of the most respected natural health doctors in the world, Dr. Cowan has spent decades challenging conventional medicine and advancing a deeper understanding of human biology, water, and natural health. His work isn't just about rejecting the mainstream, it's about offering a more truthful, biologically coherent approach for healing. The New Biology Clinic recognizes that health isn't about fighting disease, it's about restoring balance. You're not a diagnosis, you're an individual with a unique story, and healing should honor that. With virtual consultations available worldwide, the clinic offers a flat-rate monthly membership that gives you direct access to practitioners who take the time to actually listen. Members also get exclusive health live streams, a resource library, and live sessions covering everything from biofield tuning and breathwork to movement and meditation, all designed to support whole body healing. And if you're not ready for a membership, you can book a one-time appointment, sign up for an enrichment-only membership for the healing modalities alone, or schedule a free connection session with one of the care team members to see how the New Biology Clinic can help in your specific situation. This isn't about keeping you dependent on doctors. It's about making you sovereign over your health. Head to newbiologyclinic.com and use code THEWAYFORWARD, and that's spelled The Way, F-O-R-W-A-R-D, for $50 off account activation, or just head to the show notes for more info. If you're a member of The Way Forward, email hello@thewayforward.com for $150 off. Your body already knows how to heal, and New Biology Clinic helps you remember.
Remember something. Vaccination is an ideology. It's a cult. It's a religion. And so I don't think the public can handle, and I'm not being condescending here. I'm really not. I don't think the public can handle that this has been a scam. And over the years, when I've offered the information, the most common statement I get from more dads than moms, how could everyone not know this? If this were true, why isn't this more widespread? And I can't believe that they would do this versus the dads who had to believe it after they held their kid who was maimed, right? That's why, I think that the conversation we're having about vaccines in public is not the correct conversation. All right. So I think there's a different conversation we need to be having around most subjects, including vaccines. Because what I see going on in the public is what I used to see in the playground. Someone says, you're a mean kid. No, I'm not. Yes, you are. No, I'm not. Yes, you are. No, I'm not. Yes, you are. And so I remember as a kid, are not, am too, are not, am too, are not, am too. And as very well as I do, that goes nowhere. And so currently the conversation in the public is vaccines are safe and effective. And vaccine injury is rare. And unvaccinated kids are the root of all disease. Right? Those are the three major talking points. And our side says, no, vaccines are not safe and effective. No, vaccine injury is not rare. It's common. And unvaccinated kids are not responsible for spreading disease. And to me, that dialogue is the same R not M2, R not M2, R not M2. And because the people who control the narrative are controlling vaccines are safe, vaccine injury is rare, and unvaccinated kids are the root of all disease, nothing changes. Because all people hear is R not M2, R not M2, R not M2. So I believe that we need to create different talking points that are not controlled by anybody, that you don't hear publicly discussed, that allow our side, assuming that there are people on our side who really want to make the change, and I don't say that carelessly, it's our responsibility to change the talking points, because then we start directing the narrative. So here's one talking point that I remember when I first started studying the whole subject back in 1998. I remember reading this statement. Vaccines teach the immune system to recognize microorganisms before the person is exposed to them. Now, that statement is chock full of myths because it's based on a number of false assumptions that creates the foundation on which we vaccinate. Vaccines teach the immune system to recognize bacteria and viruses before a person is exposed to them. So what are the myths underneath there? One, you don't have the germ that we're vaccinating against without either being vaccinated or someone sick giving it to you. And that statement is not only false, but it can't be proven. What the explanation is for that is exposure to germs will make you sick. If no one is sick, you're not exposed to germs. More lies. The only way for you to get a germ is if someone is sick and gives it to you. So if you don't see measles virus infecting anybody in community, the virus isn't there. False. False assumption. Not based on science. And so what we're not teaching is their science. What's their science? There are 100 trillion bacteria or more lining the human body. Where are they? Nose to lungs, mouth to anus, all over the skin, and in women's reproductive tracts. Are we born with them? No. Really? No. How do we get them? Life. We get them by living. We breathe, we eat, we touch, we have sexual relations. So if exposure to germs makes us sick, we should die as soon as we're born. And so most people are not aware, Alec, that when a baby comes down the vaginal canal, in this country only maybe 65% of the time, or less in certain areas, they gather their first gulp of microorganisms. And it's not just the vaginal fluid, guys. It's the anal fluid. It's the perineal fluid. It's the stool. And so if exposure to germs makes you sick, kids should die as soon as they're born. And you realize that most people believe that germs make you sick. And we're not having this conversation. We're not controlling the talking points that say, really? Well, let's review. You have over 100 trillion bacteria in your body. And when you're born, you don't have many at all. But when you are born and you start breathing and you start eating and you get touched, you are massively colonized and nothing happens to you. What? And most of the baby's colonization happens because the kid drinks some anal fluid. I actually believe in the contagion theory, but not the way we think of the contagion theory. The reason I believe in the contagion theory is because we're never not exposed to germs. We're always contagious. We're inhaling germs because they're in the air. We're exhaling germs. We're touching germs because we're touching surfaces. And we're touching germs because we touch other people. We're eating germs because the germs are landing on the food we eat. Babies are ingesting germs because they're breastfeeding, because they're sticking their fingers in their mouth, because parents are sticking their fingers in their mouth, because kids are sticking their toes in their mouth, because kids are sticking objects in their mouth, because kids are crawling on the floor, because kids are putting everything in their mouth. We don't explain that there is never a second in life without exposure to germs. There isn't a breath we take. There isn't a moment we open our mouth. There isn't a surface we touch. There isn't any contact anywhere in our lives where there isn't contagiousness. In fact, shaking someone's hand is contagious because your germs, your microorganisms are touching theirs, and theirs are getting on your skin. Nothing happens. You pick your nose, your finger, boom. Then in your nose, other germs come out. You touch something, right? Kids eat them. See? Full of germs. There's not a moment in life where we're not contagious to our own germs and those around us and those from other people. And we're not sick. So contagiousness is insufficient to make you sick. Men, women, men and men, women and women, sexual intercourse, contagiousness, right? Brushing your teeth, man, you're getting tons of germs right into your bloodstream. Nothing happens. You wipe your behind, there's friable tissue there, especially if you're using conventional toilet paper, and you're getting the microorganisms on your anus to go into your bloodstream. Nothing happens to you. Contagiousness is a given, but that doesn't mean you get sick. And I think it's really important that we change the narrative to let people know there's always a germ going around. There's never not a germ going around. And it's insufficient to make you sick. So if you have 100 trillion bacteria in your body and a baby's born, gulps the first amount from the perineum and from the anal fluid, and then breathes, and then eats, and then gets touched, the parent is being taught that diphtheria, pertussis, and tetanus, Haemophilus influenza B, and Streptococcus pneumoniae, which are in the Prevnar vaccine, are not in the air. But the 100 trillion that are in the air, minus those bacteria, are in the air because vaccines teach the immune system to recognize bacteria before a person is exposed to them. And that statement can't hold any truth. Because number one, statistically, it's not possible. And number two, it can never be proven. Because people don't even understand that you could have Streptococcus pneumonia bacteria in your nose, sinuses, and airway and not be sick. And you can have all of the Haemophilus influenzas, the A's, the B's, the non-typable A's, the non-typable B's. You can have them in your airway and not get sick. You can have pertussis bacteria sucked right into your airway. In fact, it's one of 100 trillion. Chances are it's in the air, but you can put it in your airway, not get sick. And the one I love the most is 11-year-olds in order to go to 7th grade, 12-year-olds in order to go to 7th grade have to get the meningitis shot for 4 bacteria that can cause meningitis because vaccines teach your immune system to recognize organisms before your body encounters them. So what the medical system is saying to you, you have not encountered these 4 bacteria ever by the time you're 12 years old. And we're going to give it to you in a shot and introduce it to you because you couldn't have possibly been exposed to them because the only way to be exposed to them is if someone is sick and gives it to you. Do you see how the talking points break down?
Absurd.
Right. And so we're not having real scientific. So all you see is volley, 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 volley. Are not M2, are not M2. And that's only one of the myths that we could be using as a talking point. Because what answer do they have to that? Well, you can test an antibody to see if you've been exposed. Really? Okay. How many trillions of bacteria do you have lining your body? Nose to lungs, mouth to anus, on your skin. 100 trillion or more, right? You're safe, right? They're on you. You've been exposed. Do you have antibodies to all of them? No, you don't. But you've been exposed and you're protected. Because there's another part of the immune system that actually offers you protection that has nothing to do with antibodies. So you can never prove whether or not you have those microorganisms that we vaccinate against. Because what do we vaccinate against? 20 some odd bacteria out of 100 trillion. And they're telling you vaccines teach the immune system to recognize bacteria that you would not be exposed to otherwise. It's insanity. It's insanity. It's not even logical. It's certainly not scientific. And I think that there are many more. I have about a list of 20 myths in a document that have never been proven, but are accepted that we're not talking about, right? Like vaccines stop the transmission of a germ from those who are vaccinated. Really? How? Tell me the mechanism.
That's my favorite part. Explain the mechanism where that was shown in the human body.
Tell me the mechanism. Show me how you've demonstrated that giving a vaccine makes the person no longer a carrier of that germ. But it's accepted as truth. There are so many myths that go beyond just safety and efficacy. But the fact of the matter is that safety and efficacy have been so ingrained in the cult religion that it can never be questioned. But none of the other stuff has been ingrained, and we're not using that as talking points. I use them because parents will then say to me, well, if I'm not going to vaccinate, how do I protect my kid? I said, well, wait a second. Do you realize the question you're asking me? Number one, behind your statement is the assumption that vaccines work. And number two is the assumption that your kid isn't already protected. And so these are the talking points that, again, there can be teased out. And what I am going to do and am doing is to find the forums and the ways to put this kind of dialogue out there that makes people go, huh? Because that's all you need. Because it changes the safety, not safe, effective, not effective, to, wait, why are we vaccinating?
Yeah. What are the underlying assumptions that haven't been demonstrated in the first place? Yeah.
And again, I have about 19 or 20 of them, and there are more. I'm still working on the myths because they just keep coming up.
Yeah. Yeah. Yeah.
So there are just so many assumptions. And a lot of it is based on the inaccurate contagiousness theory.
Yeah.
Right? Because I gave the accurate contagiousness theory.
No, I like that reframe. You talked before we clicked record, like I have something interesting to share with you. Yeah. I'm like, you know what? I like that reframe because we're all sharing microbes all the time.
Just exhale around somebody.
Yeah, literally exist.
What do you think's coming out of your mouth? They're not always pearls of wisdom spilling out of your mouth. Sometimes they're germs. In fact, every time they're germs.
Every time. And then that's the preconceived idea. And I think Daniel Reuters has done a fantastic job. Have you read his book, Can You Catch a Cold?
No.
I highly, highly recommend checking that out because it's incredible. I mean, it's still the presupposition that germs are the causative agent instead of the cleanup crew themselves. They're playing a symbiotic role in our bodies.
So I'm gonna take a curveball in the conversation, if you don't mind, because this leads me to another point that I think is not talked about. And that is that the entire culture believes that illness is an infection, period. Acute illness. Mm-hmm. Acute illness is an infection. And it's going to be tough to break down that paradigm. Because of my exposure over 30 years ago to other fields of medicine, I early on started realizing that an acute illness is rarely an infection. And so my pediatric practice for well over 25 years has been your child's not infected. And it's a really hard sell, Alec, because again, the culture has such a great talking point that if you get a cold and a runny nose and a cough, you caught a virus. Instead of, wait a second, as viruses go, under the umbrella of how Western medicine understands viruses, we have maybe 400 trillion pieces of viral material in our body. And you're telling me that the only time I'm exposed to any virus is if someone is sick and gives it to me? And you've never even quantified or qualified what that thing is that they're giving to me, but you just name it anyway, right? You create a mythology around it. You create a story around it. So once we start understanding that acute illness in children and in adults is less often having to do with any infection and more often to do with the strength of the body, we can start breaking down the whole germ issue. Because once people start to understand what the Western medical system teaches a virus really is, which is an inert material. Like if you open up the viral textbooks, forget is there a virus? Do viruses exist? Blah, blah, blah. If you open up the textbooks that virologists write, what do they say a virus is? An inert material. What does that mean? It has no ability to do anything in and of itself. Like bacteria, they can do stuff. They can swim, they can crawl, they can reproduce, they can feed, they excrete their excrement, they can, interact with each other. Viruses do nothing. Nothing. I mean, that's what virologists teach.
Right.
They are inert. Now, there are half of the virologists that actually believe that. And then there's the other half that said, no, they're active, alive. No, they're not. No, they're not. They're not. Because if you actually look, what is a virus before it's a virus, right? That's the question I used to ask in my lectures years ago, over 15 years ago. What is a virus before a virus? It's a piece of genetic material. It's a recipe. It's nothing. It's nothing. It's just instructional material, but it can't do anything because it's nothing. And if people want to understand what a virus is before it becomes a virus, ask yourself what an insulin gene is. What's an insulin gene? Piece of genetic material. What can it do on its own? Nothing. What's the only way that insulin gene gets activated? If an external force signals the genetic instructions to turn it on and make more of it. Viruses are the same. So in and of itself, they can't do anything. They need a genetic string, the way a gene to make insulin needs a genetic string to get signaled, to transcribe, to bring product to market. And so without an epigenetic expression, a force, these viral materials are dormant. And they're all over the body. They're in the chromosomes. They're in the mitochondria. They're in the bacteria. And Lord knows where else they're hiding because microorganisms morph all the time. So the most fascinating thing to me is how people don't know their bodies and what's in their bodies and the number of germs that are in their bodies and what those germs are doing, and only think that they come from the outside. And that if you don't have a symptom of an illness, you don't have the germ. And these are the talking points we're missing. Because once people realize man, you got a couple of 100 trillion germs in your body. And you're saying that the 20 some odd bacteria and the 20 some odd viruses that we vaccinate against are the only germs not in your body, but 400 trillion are? Anybody who's a statistician knows that that's bullshit.
You know, I've often said, wait until the people who are pushing the war on germs realize that we're literally made of them.
We are them.
Literally.
Yeah.
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 It's a war on us. It's a war on us. That's what it is.
That's my point, Alec, is that you can never have a second of life without germ exposure. Your very existence. Like, you know, I'll look at people and say, can you see the air around you? No. Do you know what's in it? No. Trillions of germs. Really? Yeah. What do you think you're breathing in? You know, and when parents don't want their kids to play on the floor because they're afraid that there are too many germs on the floor, on a surface. I'm like, well, do you understand that there are wind currents in every room, no matter how still it feels? And do you know those wind currents are just blowing stuff up from the floor, blowing stuff off from the surfaces? And they're in the air and we're breathing them in. The biggest talking point is exposure to germs does not make you sick. And that's the talking point that they have no answer to. But it's the foundational belief as to how we get sick.
And it's just wild to really like reflect on that because it's a complete inversion of what is.
Correct.
Complete inversion.
And that's why I said we're having the wrong conversation. Again, it's just my view.
Yeah.
You know, it's sort of more of a wish because when I see they're safe, they're not, they're safe, they're not, they're safe, they're not, we're rearranging the chairs on the Titanic, right? But we're not having the conversations that actually uproot the foundation upon which we do these things.
The conversation regarding safe or not safe is irrelevant when you understand the foundational premises that give way to vaccination in the first place have never been empirically demonstrated, and we're completely coming with the wrong assumptions.
Many mythologies. I've done plenty of episodes on the other mythologies down to the nitty-gritty details. You know, it's wild to me to reflect on that. And one of the false binaries that exists, that is prevalent right now, and we discussed this on the phone before we recorded today, is on one side, the medical establishment asserts that vaccines do not cause autism. And then on the flip side of that, we have well-intentioned moms and people who have been gaslighted to the nth degree who say, no, vaccines do cause autism, almost in a sort of myopic way, unintentionally, but in a myopic way because they've been gaslighted so much, right? Where
they focus on vaccine almost without saying it being the sole cause of autism.
Right.
But the reality is, as you and I were discussing, there are a variety of things in our environments these days that lead to neurological issues like autism and lead to chronic illness. And this is the broader conversation relating to what we were just discussing. So it's not what we've been conditioned to believe. It's not the germs. There are a variety of things in our environments that we need to look at now. And that also relates to what are the cause of chronic disease? What is the cause of autism and things like this?
So I think this is a really important topic, and I'm glad you brought it up. There is no doubt that those parents who gave their kids shots and saw brain deterioration didn't know it was the shots.
Amen. Agree.
So in their world, they are right. I agree with them. Their experience is real. They saw it, they live with it, they know it, and no one can tell them otherwise. Every shot causes brain damage. Every shot causes brain damage. It doesn't mean you see it. It doesn't mean it presents as symptoms, but every shot causes brain damage or some form of immune dysfunction or neurological dysfunction, cellular dysfunction, mitochondrial dysfunction, toxicity, all that we talked about. Nonetheless, I don't like to pigeonhole into autism. because it's 1 in 31. That's true. But the diagnosis is handed out differently than the way it was handed out 40 years ago when I first saw my first cases of autism as a medical student.
Quick aside, do you think that's intentional? Like it's an obfuscation, sort of like muddying the waters, so to speak?
No, I just think that people need a diagnosis to get services.
Okay.
And there are a couple of core symptoms that are enough to put down a DSM-4.
See, this is the whole conversation, separate conversation regarding the DSM.
But also, Alec, I want to say that 30 years ago, when I was an ER physician, I was already seeing families glom onto the label for their kid.
Got it. Yeah.
I was already, instead of parents sitting around talking about strollers and onesies and rattles and, games and toys, they were now talking about which specialist they were going to, what diagnosis they got, what medicines their kids on, what appointments their kids have. This was 30 years ago. This was in the 90s. I was still an ER and intensive care doc. And I was watching parents just sit around. Oh, my kid has this. My kid has this. Oh, what does your kid have? My kid has this. So labeling became, I don't know which came first, the chicken or the egg, because the medical community started labeling. I mean, ADHD became a label that has broadened. Autism became a label that broadened. I prefer looking at 1 in 6 children has neurodevelopmental disabilities. That's the problem. 1 in 6 children, and probably higher, has some form of brain injury, brain inflammation, brain dysfunction. What the hell? What do we do in our kids' brains? That encompasses autism, ADHD, seizures, learning disability, right? Behavioral problems, mental, emotional problems, etc. So we've got a crisis of kids who have brain damage, brain injury, brain dysfunction. Certainly, we know how the ingredients in the vaccines can contribute to that. But there are a lot of kids, and I gave a lecture at a medical conference in March of 2025, where I went over more than a dozen reasons children can have neurodevelopmental disabilities unrelated to vaccines. I mean, one of them was vaccines, but mold exposure, mold toxicity can do it. Food allergy and sensitivity can significantly do it. I mean, Dr. Feingold started this years and years and years ago when he identified the role dyes, preservatives, additives, food colorings can play in causing adrenaline brain chemistry. And so if you take the dyes, the preservatives, the additives, the food colorings away from the kids, they're not hyper anymore. They actually slow down. They actually can focus. They can pay attention, right? They can sit still. Air pollution, metals, right? Pesticides.
Non-native EMFs.
Electromagnetic radiation. Poor sleep. I mean, I've had kids who are diagnosed with ADHD and we got them sleeping and their symptoms completely disappeared. Poor vision. I've had kids who had ADHD, unable to sit still, tantrums, outbursts, poor vision, sat still in school, learned, focused, paid attention, got good grades, slept well, boom. Addictions. And what I'm now seeing in children, I did a presentation a year ago at a conference where I gave a case report of a 15-year-old boy who came to me with a diagnosis of ASD, autism spectrum disorder. And I looked at the mother and I said, I don't want to know the diagnosis. Let me get to know the kid. And I looked at all of his history. I looked at his physical exam. I looked at all of his symptoms. And I said, this kid doesn't have autism. He's addicted. And when you're addicted, the front of your brain doesn't work. You can't focus. You can't pay attention. You can't problem solve. You can't think. You can't reason. You can't figure things out. You can't concentrate. You can't learn. You can't even speak well, right? You can't write because the front of your brain which is where all of those, attributes I just reviewed come from, which is the function of the front brain, are turned off when you have an addiction. And so the parents looked at me and said, really? You don't think he has autism? I said, not at all. He didn't have any of the canner symptoms going back to the 1940s that I saw in 1985, 86 as a third-year medical student. And I said, he has an addiction. I said, and as a result of his addiction, he's shutting off brain development because the part of the brain where addictions reside are the back of the brain. And that's the fight or flight response. That's the dopamine response. That's the adrenaline response. That's the, if I don't get this, I'll die. That's the immediate gratification. Right? That's the part of the brain that survives, right? And salivates, And so when that brain is active, brain development stops. So he wasn't trying things. He wasn't engaging in life. He wasn't enjoying life. He wasn't socializing. He wasn't learning well. He wasn't sleeping well. And the parents got it. And they went home. They had him see an addiction counselor. They worked with an addiction counselor. They completely cold turkey on the video games and the devices.
That's what I was going to guess. It was
cold turkey,
one of those
addiction.
Yeah. Well, especially in kids these days is what I'm saying though. That's the issue.
You don't give a heroin addict a little bit of heroin at a time, right? You have to give them a methadone. You have to give them something that will soothe them, but doesn't addict them. And so he worked with him, and I saw the kid for a follow-up maybe 9 months later. He grew 6 inches in 9 months. He gained over 10 pounds. He was sleeping. And all he could talk about was the friends he was meeting, the activities he wanted to be engaged in, how good his grades were, how he's learning, how he's interested. He's thinking about college. He wants to drive. He wants to do all these hobbies. But he wasn't doing any of those because his brain was blocked from living life. And that's what is creating a tremendous number of neurodevelopmental disabilities that are outside of what we call vaccine-related injury.
Yeah. And
certainly a vaccine-related injury with addiction on top of it is just disaster.
There's a recent poll that I put out on all my social media channels, and 95% of people responded that they're struggling to find their health and freedom community in person. And don't get me wrong, these platforms, these devices that you're listening to or watching this podcast on right now are great for helping to disseminate information, helping us, find like-minded people to validate us, but they are not a replacement for real in-person community. At the core of our new community platform is a powerful, easy-to-use map helping you to instantly connect with like-hearted, like-minded community, including men and women, farms, schools, practitioners of all types, and other businesses near you. The platform also includes groups, social functions, messaging, and Platinum members also get access to our content library with footage from all of our in-person and virtual events like Confluence and the end of COVID, as well as breathwork sessions, Qigong sessions, member Q&As, and also member community calls. So if you'd like to support this podcast and support our mission of helping people to connect hyper-locally in person, and also obviously support yourself in the process, go to the show notes or just go to thewayforward.com/join. And again, the way forward is spelled thewayforward.com/join to become a member today. Help us build the way forward for mankind. This is my issue with the autism spectrum and autism spectrum disorder is when I was referring back to muddying the waters, we could speculate all day whether that was intentional or unintentional or like there is good intentions behind it, right? But what happens on all sides of this topic now? And you see it anytime RFK or someone who has a platform in the mainstream refers to autism in relation to any of the things out there, whether it's vaccines, Tylenol, things like this, is on one side, you have the moms who justifiably come out with their, just like gritting their teeth angry because they feel like they've been gaslit and they have, right? And they're pointing to, look, my kid has legitimate autism. This is what autism is. It's wearing a helmet. It's not being able to speak. It's wearing a diaper into age 20 and beyond. And then on the other side of that, the people who have mild social quirks, who get offended at what RFK or others are saying. And that's what I'm talking about with the issue, is that both sides feel invalidated. And I think that it goes back to how the waters have been sort of muddied on this issue, and all of them have been put under the same umbrella. The individual who has mild social quirks is considered on the same spectrum as the individual who's 20 years old and wearing a diaper, can't talk.
Again, this is the need to be labeled. You know, you are not a person, you are autistic.
Yes, right.
You're not a person, you're a cancer. You're not a person, you're diabetic. Right. And that's the problem, is that we've lost the ability to say you're a person who might have autism, or you're a person who might have neurodevelopmental disabilities. I rarely like to talk, whenever I'm in an audience, whenever I'm in a panel and people start talking about autism, I immediately change the subject to 1 in 6 children with neurodevelopmental disabilities, because the picture is much larger than just children with autism.
Yeah.
I'm not diminishing the autism.
For sure.
Right. Because we get roped into autism, the conversation goes down an alley that doesn't really address the larger problem, which is we're poisoning the brains of our children, and we're doing it knowingly.
Yeah. And in neurodevelopment, when we talk about that, we're talking about autism inherently, because that's a piece of that,
Correct.
Right? Without having to even say the word autism.
I mean, even the educational system
Yeah. Oh my God.
is destroying brain development, right? Because it's, George Carlin does such a great series on the American educational system, and, the dumbing down, and they don't want you to critically think. They don't want you to learn, it's a big club and you ain't in it. And the thing is that it's very hard when you're in it to believe that this has been created to screw you. And I think COVID allowed many people to go, oh, wow, I'm in a system that was created to screw me. And the system, as I understand it, is starting to shake
violently,
because they're realizing, people are hesitant. And instead of trying to understand why, they're doubling down and trying to become more tyrannical. And that's only going to create more polarization and who knows what, right? More chaos. Yeah. I'm hoping not, but the fact of the matter is that, I think what I would see, again, I'm not a forecaster, I'm not a prognosticator, but what I would see is what Dr. Latipo is doing in Florida is, you want vaccines? Go ahead. But your very existence in society, your permission to breathe, eat, sleep, educate, walk, run, exercise, isn't predicated on whether you had a shot. And again, that makes people go, yeah, but all of us who are vaccinated are protecting those who are not vaccinated. And like, yeah, this is one of those talking points. That's one of the myths that, my favorite approach to anyone who says that, is similar to, Zoran Mondani won as New York City mayor, and people would go interview the supporters and say, why are you supporting him? And they'd, and they never say anything.
Right.
Right. And it's the same thing as to what happens if you say to somebody, tell me, how does vaccinating your kid protect those who don't get vaccinated? Explain it to me. No, I'm curious. Tell me the science behind it. Nobody has a clue. Even doctors don't know the first thing about it because it's related to herd immunity. The theory of herd immunity, which is based on an extrapolation for vaccination from the theory of herd immunity of natural infection, which is a theory and wrong. Makes no sense, right? And so when I start to elucidate what the theory of herd immunity is about, it goes back to what I said before, which is you don't have a germ in your body unless someone is sick and gives it to you. And if you're not sick, then you don't have the germ. And that's not true. And so that's where the theory of herd immunity breaks down. Because the theory of herd immunity with vaccination truly believes that when enough children are vaccinated, there's less of the germ to go around because vaccines make the germ disappear. And so only those who are unvaccinated are the carriers of said germ, because when enough have been vaccinated, there's so little of it to now be transmitted into the community. Wow.
Batshit.
Wow. Wow. I mean, wow. You know, I want to know how a vaccine, when injected into the body, makes your body no longer able to transmit or carry that germ. I want to know. Because you can't even prove that being vaccinated is making you immune in the first place, let alone making the germ disappear so you no longer carry it or transmit it. Wow. That's some serious mythology. And, you know, it takes somebody really wanting to and willing to think it through. But we're losing people's thought processes.
Yeah.
Between the poisons that they're exposing us to, the cell phones, the apps, the social media.
Social media, I think, is one of the biggest ones, though. You know, I've had multiple people thank me for my podcast for this simple reason. The way social media is designed now is short form content where you're just mindlessly scrolling like this, and it's capturing our attention spans and making it so we can't pay attention for more than 60 to 90 seconds. My episode average length is 2 hours and 40 minutes.
So I'm going to take that statement deeper. It speaks to the nature of human longing. As humans, we are always longing, regardless of what it's for. We're always longing for something. We're yearning for something. And it's often a yearning and a longing for pleasure.
Mm-hmm.
Right. The apps and social media give you a dab of pleasure, but not enough. And so there's got to be more. There's got to be more. There's got to be more. That was fun. There's got to be more. There's got to be more. And it's no different than the dating apps, right? Swipe, swipe, swipe. Oh, there's got to be better. It's got to be better. 6 hours later, I'm still swiping, right? And so what that does, and I think Dr. Phil said this on national television back in 2024. He said that when we were kids, we lived our childhoods. We lived life. Nowadays, most children and adults are watching other people live their life. And so you end up having a shallow nature because you have no experiences of your own. Because all that you can talk about is what you saw, heard, watched, read of others. And so it's the perfect way to create an obedient, subservient, and paralyzed society. Because when those who have been enmeshed in these social medias, apps, and addictions they come across something in life that isn't matched by something they saw, read, heard, watched, they need an outside authority to fill it in for them. And so you've got a customer for life who's going to just follow anything you want. And that's why I beg parents to not do the following. Don't fix your child's situation. Don't solve their problems. Don't correct their mistakes. And don't answer their questions. Because you become extremely great. You're magnanimous if you do. If you fix them, if you solve for them, if you correct them and answer them, you're a wonderful person. But you leave them crippled because all they have is what you did for them. But what they don't have is how you guided them to do for themselves. And if you want to build a confident, self-sufficient, stable child, you got to make them struggle. You got to make them figure it out. You got to make them try it again. You got to make them fail, right? You got to make them, cry a little bit. You got to make them tough it out. Now, I'm not saying you got to hold them out the second floor window and make them suffer, but I'm saying don't fix it. Give them a chance. Okay, try it again. Go at it again. See if you can try it this way. If they can't do the problem, guide them. If they make a mistake, don't tell them the right answer. Look at them and say, are you sure about that? I don't know. I think you need to go back to the drawing board because I don't know if that's the right answer. But don't give it to them. And don't answer their questions. Dad, what's this? I don't know. What do you think it is? Well, tell me. No, I don't know. I want you to figure it out. Right? Because what you'll be doing is really like getting the juices flowing. Yeah. And there's no reason for juices to flow if you're sitting there dumbing, right. That's what you're doing. Right. And then all of a sudden you pick your head up and you go, what? What's my name? Right. Because you're in a cloud because you've cut off most of your brain function. Yeah. I mean, it's going to have to work itself out.
Yeah.
Because there's nothing that anyone can do to stop this speeding train. It's gone. The train left the station and these young kids, even your peers, teenagers, 20s, 30s, lost.
So many of them.
Completely lost. And I'm not judging it. I'm just saying that they missed out. What I look at parents and kids in the office and I say, every age of your childhood, every age of your life, there are psychological, emotional, social, mental, physical, and spiritual milestones that you must experience. Like, there's no getting off this ship, right? You're on the ship and you can certainly ignore them, but they're never going to go away because they're going to rear their ugly heads one way or another. But every age, you have these milestones. What I'm watching is that the kids are not going through the milestones. So you have young men and women in their teens, 20s, and 30s who just stunted development. Talk about the show Arrested Development. I mean, that was before its time because there's not enough emotional intelligence because people aren't interacting. They're just sending it to somebody else. Did you see this? Did you see this? Did you see this? But there's not enough personal interaction. And certainly the lockdown and COVID destroyed a lot of kids, especially at the young ages.
Exacerbated that tremendously. Yeah. Yeah. So when we're talking about making our children well again, what does that look like in your pediatric practice? Especially coming from what I would say is the antithesis of what most people in our space think pediatrics is about, because most of us assume that pediatrics is synonymous with just pushing shots.
No, God.
But they're understandable. I
hear so many people say, why do you need to go to your pediatrician? What do you need a pediatrician for? If you're not going to vaccinate, what do you want to go? Well, come to my office and you'll find out.
What do the kids look like in your practice?
What do you mean?
Like relative to the average child in America these days, what is the state of their wellness?
So I have different kids in my practice. I have kids who have not received any shots and they are neurotypical. They're not advanced. They're neurotypical. They are meeting...
Important distinction, by the way.
Right. They are meeting the developmental criteria that are in the textbooks from the 1910s through the 1980s, where we learned what normal development is.
Can I say something real quick as a dad?
Please.
The amount of times that people comment, whether we're at the store or just out in public, about our kids when they're in their infancy or when they're toddlers. So we have a 7-month-old right now. The amount of people that comment on how observant he is, on how he really looks into their eyes, almost like he's looking into your soul, how he really pays attention to you, is crazy to me, because for us, it is normal. But for the overwhelming majority of society, people look at that as an anomaly.
Right. That's because the bar has been moved.
Right.
So they're so accustomed to seeing developmentally delayed children, which has now been normalized, that when they see kids like yours, they think, what's in your water? Right? Because they don't have any context.
Yeah.
That those kids in your home have always been like that if they're not poisoned or educationally destroyed. Right. So I have kids in my practice who've never received any shots, and they are the healthiest kids I've ever seen. They're neurotypical. They're what others would call advanced, but what I call strong, healthy, vibrant, connected. There are kids who've gotten some vaccines. There are kids who've gotten many, and those are the ones who are chronically ill. And my goal is to help restore the innate capacity to heal, right? And so one of my favorite statements that I don't say publicly very often, but I'll throw it out here, is it ain't enough to not vaccinate. If you want to make children well again, it's not enough to just stop vaccinating, because there are many things that contribute to the health of your child and the well-being of your child. And there are things at the body level, the mind level, and the spirit level. And, I had a kid in my practice the other day, newborn, second baby, terrible acne. And I said to the mom, yeah, this is the extrusion of fetal toxins. Whether it's just fetal toxins or whether it's toxins that are in your milk that are coming out, or both, he's getting them out. Great. Good for him. What do you mean, fetal toxins? I said, well, depending on the amount of stress that you were under and depending on what you were exposed to during the pregnancy, that builds up inflammatory material. He's affected by it, but because he's healthy, he's got to get rid of it. And so now he's getting rid of it. And she says, really? The stress during my pregnancy could have affected him? Right. So as a society, we don't pay attention to the choices we make, to the lives we live, to the foods we eat, to the sleep schedules we have, to the seasonal changes we experience, to the material we put on our skin, to the material we put in our air, to the material we put in our nervous systems, the overload of information schedules in EMF, right? We don't pay attention to the mold and the detergents and the, dyes, the preservatives, the additives, the food colorings, the pesticides, the metals. And we think that if we just don't vaccinate, everything will be fine. And so it ain't enough to not vaccinate. And if we're going to make children well again, we're going to realize that if children are chronically ill, it's because of 3 problems. One, the overarching problem, that's not one of the 3, is they're chronically inflamed. Inflammation just means too many wastes, too many toxins, too many impurities. And so there are 3 issues to address. One, there are too many inflammatory materials coming into the body. 2, there are too many inflammatory materials that are circulating in the body that can't get out. And number 3, your body's not able to get rid of enough. So it's just traffic circles, right? So if you're going to help these kids, you got to look at what's coming in. So you got to look at the air, you got to look at the mouth, you got to look at the skin, you got to look at the injections, you got to look at the nervous system. And you got to look at the spirit of the child. Are you doing what's in the best interest of the child? Because that's speaking to the spirit of the child. Or are you, I don't want my kid to feel bad. So you're just going to give in because the child will be unhappy. Well, that's not your role. Your role is to do what's in the best interest of the child. The tagline for parenting that I use in the office all the time, Alec, this is going to hurt me much more than it's going to hurt you. And I learned that as a kid, right? Parents to parent have to do things that they don't like, but it's going to hurt them more because what they're really doing is what's in the best interest of the child. Mm-hmm. And so if we're looking at body, mind, and spirit, if we're looking at the ways in which we bring information into children, we can lower what's inflammatory. We can raise what's honoring the spirit. We can give what nature needs the body to have, right? If we're really allowing children to develop properly, if we're educating them properly, if we're parenting them properly, if we're feeding them properly, etc., then yeah, they'll thrive. But if you just don't vaccinate and you feed them certain ways and you have stress at home and the emotional stuff is going on, the educational stuff is a problem, and there's yelling at home, and you don't care what kind of products you feed them or what skincare products you use, or you don't care about detergents, you don't care about mold, you don't care about parasites, you don't care about air pollution, you don't care about the EMF, well, then it's not enough. It's just not enough. And that makes parenting a lot more difficult today than it may have been 40 years ago. But we need a reframe. We need a reframe. And the fact of the matter is that parents can do it as long as they get off their phones.
That's a big one too, because our kids are just mirroring our behavior in a lot of ways. Yeah. As a final, I'd say 2-part question here. If you had the ability to be the individual who can totally reframe how pediatrics are taught, what would you do? What would you teach? What would you not teach? That's a big question. And then the second part to that question is, in this emerging paradigm that you and I are both a part of, what is the role of allopathic medicine in the future?
I'm going to answer the second one first because I remember it more than the first one. Allopathic medicine is brilliant. We don't practice it. We practice pharmaceutical medicine. We practice fear-based medicine. We practice protocol and algorithmic medicine. We practiced symptom suppression medicine. We practice root cause doesn't matter. But the roots of allopathic medicine. So now for people who have listened, I'm coming full circle to something I said at the very beginning of the talk, of our discussion. I found the science in the body that explains how the human body has the innate capacity to heal in the Western medical teaching. So if we really go into the ologies of the body, all of that information about how the body has the innate capacity to heal is there. It's not taught in medical school and it's not practiced because pharmaceutical medicine and petroleum-based medicine and surgical medicine is the only thing that's allowed. So teaching allopathic medicine the right way that holds the principles of the science of the body, that the body has the innate capacity to heal, in line with all of the other healing modalities, is easy. And so that's what a medical school residency practice could look like. But we would have to reframe why the body gets sick, why the body gets chronically sick. We'd have to do prevention. We'd have to be proactive. We'd have to take responsibility. We couldn't just say, Oh, well, I couldn't feed my kid good food. No, I can't do that. We're not going to be able to do that because we're losing the resilience to be able to tolerate. We're going to have to learn about seasonal eating. We're going to have to learn about seasonal living.
Circadian rhythm health.
Right?
Yep.
We're going to have to learn about food as medicine, right? We're not going to learn that, avocado's a great first food for babies. No, it isn't. And we're going to learn why, right? We're going to start learning that food is energy and people are energy. And the relationship between food and people is energy. And it needs to be eaten as energy. That different cultures know that empirically, right? And I have a lot of families in my practice that come from other countries. And I bring up their native cultures and their cuisines. And I show them the disparity between what they're eating here in America and what their ancestors ate. And I'm like, do you notice what has happened to the health of your children when you started to eat American food? Well, but my kid likes it. Yeah. And you'll attest to this because you're a dad of 3 kids. When your kids are born, you give them everything they need and everything they want. And then you have to stop that lie.
Yes, that is so true. I think that lie continues to dissolve the more you have kids too, right. I would say.
Because now you can't give them everything they want and you can't give them everything. But when they're babies, you lie to them that you will. Right. But then when they grow up and they start moving into the environment, you're like, oh, I can't give you everything. And not only can't I give you everything, I can't do everything for you. Right? And so we have to allow that as part of our parenting, that we can't give kids what they want all the time. And we have to give them what's in their best interest. That doesn't mean you withhold pleasure. That's not what I'm saying. But your job as a parent is to give them what's in their best interest. And sometimes the best interest is not to give them what they want. So we're at a really interesting place. But, we're going to have to revisit the germ theory and the terrain theory. And we're going to have to revisit, again, why the body gets sick. And we're going to have to look at cleansing. And you notice in this whole time we're talking, I haven't said the word detoxification because it's not a word I like. But yeah, we're going to have to revisit the science of the body. Like when you exhale, you're getting rid of wastes. And when you pee, you're getting rid of wastes. And when you poop, you're getting rid of wastes. And when you sleep, you're getting rid of wastes. And when you sweat and smell, you're getting rid of wastes. And when you produce mucus, you're getting rid of wastes. So if you produce more mucus, you're getting rid of more wastes. If you sneeze and cough, you're getting rid of more wastes. If you have diarrhea, you're getting rid of more wastes. If you have a rash, you're getting rid of more wastes. If you sleep a lot, you're trying to mobilize and get rid of more wastes. And if you urinate more or bedwet, you're getting rid of more wastes. So why would we call that an infection? Why would we suppress those symptoms? When parents say to me, well, what can I do to dry up the mucus? Why would you want to do that? Do you understand what mucus is? Right. What do you mean? It's an infection. I said, is it? Why does your body produce mucus when you don't have symptoms? I don't know. Your body produces mucus when you don't have symptoms to get rid of wastes. So if you're producing more symptoms of mucus production, what quantity of wastes might you have? Right. So again, it's our job to reframe. And that's sort of one of the pieces that I've come to understand about how the body has the innate capacity to heal. Right? The expression of symptoms is a mere augmentation or upregulation of normal body function. So why would you call that an infection? Especially when you have over 400 trillion microorganisms and you're never not exposed to germs. So there's always germs going around. And you're not sick most of the time. So you're telling me that there's some special germ going around only when you're sick? Come on. It's such a myth. It's such mythology. Aesop's fables all over again.
Amen.
So again, we have a lot of work to do around personal responsibility, being proactive, prevention, being in right action, allowing experiences to teach us, being accountable, being ready to, step in and step back, don't just stand there, do something, and don't just do something, stand there.
Beautiful. Beautifully said. I love you, Dr. P. This has been awesome. As we're closing up, is there any last thing you'd like to share?
If you're interested in more of my work, go to drpalevsky.com and you'll see lots of information on there. Things I've written, podcasts I've done, interviews I've done, documentaries I've been in, et cetera, et cetera. But I really encourage parents to be curious, to be willing to not know, to be willing to be uncertain, to be willing to fail, and to try to provide a safe enough environment for learning to happen.
Beautiful. Thank you so much for being here.
Thank you, Alec. Great job. I enjoyed it. Thanks.